Hi everyone, I am Uzma Hasan. I am the Division Director for Pediatric Infectious Diseases at Cooperman Barnabas Medical Center. I am here to talk to you about COVID in pediatrics. In the last 2 weeks, we have seen an uptick in pediatric cases, almost a 4% increase. So far, there's been 6.9 million cases in children and 132,000 new cases within the last week all over the country. As we know, we are hitting winter. This is the time that we see a rise in pediatric COVID cases. So we're here to discuss some recommendations on how you can keep your families safe. We know viruses mutate, and sometimes the mutations make them stronger or weaker. The Omicron variant, which was first described in South Africa on November 30th, became a variant of concern. There are about 30 mutations of the spike protein in this variant, which makes us a little concerned whether our conventional treatments will be effective against this variant. We do know that vaccination is still protective, and we are still learning about severity of illness related to this variant. Absolutely, yes. We do know that vaccination is more than 90% effective in preventing symptomatic illness from COVID in this age group, and 100% preventing hospitalizations. We know that we see milder illness in general in children. However, the biggest rise in multisystem inflammatory syndrome within the last several months has been in the 5 to 11 age group, and vaccination is protective in preventing hospitalizations. So if a child is vaccinated, they do not require quarantine. What the recommendation is that they get tested anywhere between 5 to 7 days post-exposure. If a child is unvaccinated, the recommendation is that they be tested immediately post-exposure, and then repeat testing is done 5 to 7 days post-exposure. In the child who's unvaccinated, regardless, they have to complete out the quarantine phase of 14 days. Some clinicians may shorten that phase to 10 days, depending on what the local health authorities advise them to do. So as you may be aware, the CDC has put out a health advisory warning for certain parts of the world. Make sure you check the CDC website before travel. The US now requires a PCR test to be done within 24 hours of return to the US. Anybody who is traveling needs to check the country that they're traveling to, their recommendations or requirements for PCR testing before they travel. And anybody with international travel who is unvaccinated is required to have a PCR test done about 3 to 5 days post-return, and then quarantine for a 7-day period, regardless of what your test shows. If your child is symptomatic with a COVID infection, the recommendation is that they quarantine for a period of 10 days, and they are fever-free for 24 hours without any fever-reducing medications, and symptoms improved before they can return to their normal routine. If your child is asymptomatic, then the recommendation is again that they quarantine for a full 10-day period. In that time, if at any point they start developing symptoms or so, they should seek advice from their healthcare provider. As you may have heard, this is a medication that is administered to prevent progression of illness. As of now, we are using this medication only in severely immunocompromised children who have either diabetes, severe asthma, which has required ICU admissions, or intubation or ventilation, kids who have chronic kidney disease, kids who are severely immunocompromised, like our transplant patients, etc. If monoclonal antibody treatment is a consideration, you must discuss this with your primary healthcare provider, as well as there is a hotline that has been set up for our healthcare system, which gets contacted to determine if your child will be eligible and will benefit from this treatment. So severely immunocompromised children between ages of 12 to 17 may be eligible for booster doses as per AAP recommendations. If your child is severely immunocompromised, discuss this with your pediatrician. So make sure that all the immunocompromised seniors in your family are vaccinated, including booster doses. And especially during the holiday time, we want to be making sure that we protect the vulnerable around us. So there should be no laxing in preventive measures. Make sure that you're masking in an indoor setting if you're not vaccinated. Make sure that you're diligently washing hands, and we still say to practice social distancing if able to. The local health department is an excellent resource for all school systems. We say that if a child has any high-risk symptoms, if they have cough, they have shortness of breath, or they have loss of taste or smell, that warrants testing immediately. If kids have low-grade symptoms like where they have a little bit of a headache, they have vomiting or diarrhea, etc., or a sore throat, the 2 or more symptoms should warrant testing. Usually if there is a cluster of cases that are linked in the classroom, and for most health departments the magic number varies. For the local health department here, it's 4 or more cases in the classroom. That's when the school system discusses with the health department whether the class should be quarantined.